So caring for loved ones, family, friends that may struggle with schizophrenia can be challenging, and it really depends on the person. So if you have someone who's new to treatment, new to the diagnosis, there might be a lot that's required in terms of helping them to organize their appointments, organize their treatment. It may be a lot of work to help them grapple with the fact that this is happening to them. Sometimes we can lose sight of the fact that we're not taking care of ourselves, whether it's our mental health, whether it's our physical health. We may become more isolated and withdrawn because we're solely focused on taking care of our loved one. We may also be struggling with some embarrassment and shame. Families who might be struggling with supporting their loved ones for various reasons can look to seek support through some national organizations. NAMI is a really good organization where they provide a lot of support and guidance for families. Also, talking to your primary caregiver or maybe your places of employment. Sometimes the EAP offices can tend to have resources that can be helpful. There are lots of hopeful changes on the horizon that will make accessing care and support much easier. Regular routines are important for most of us, especially in the earlier stages of treatment, to be able to establish and develop good healthy habits, to be able to establish a routine by which you can kind of consistently make sure you take your medication and keep your appointments. It gives you structure, and structure is helpful to keeping us on task. So if someone's experiencing acute psychosis, there are a couple of things that we need to think about and consider. First is always safety for themselves or safety for other people. That's an emergency and we have to take emergency steps. If there's not safety concerns, the way that you approach it is to be, respectful, warm, and understanding. Try to validate their experiences because it's important to know that their experience is real to them. From that point, try to figure out how you can work with them to engage and seek help. Caregiving for a loved one is a huge ask, and it's not something that should be taken lightly, and it's not really something we should really try to embark on our own. On the airplane, they tell us to put on your own face mask before you help your kids or help other people beside you, and that's really important because we can't really do the best that we can by someone else if we're not doing the best that we can by ourselves.